You're so sweet.
I know.
All right, I am live.
Do you have any friends yet?
I've got one friend who's shown up so far.
Is it Nan?
No, I don't think so. Not yet, anyway. It says, we are notifying viewers that you are live. Hello. All right. We got 6 people in the chat. I'm gonna show them. I'm gonna show you. Oh! What are you running away for?
Ugly right now.
You don't want to come say hi to all 11 of my friends? Tina says, how are you?
How are you?
Lovely family. Yes.
Well, are you gonna say how you are?
I'm great. I hope, and my daughter is doing great too. She just had a birthday recently. If you were on the live when I was wearing the princess crown to start, that was Sunday. She turned the big 1-3. Anybody else go through nursing school with kids at home? My daughter was in 2nd grade when, yeah, 2nd grade whenever I was going through school. Mm-hmm. Yeah, for 2 years.
Crazy, dude.
Yeah, bro.
You should talk.
It's a whole degree.
You have to go to school for that?
Uh-huh. Yeah. Yeah, I mean, you've heard the questions. They're hard. Going back. All right. Jennifer says she's going back for her BSN now with 2 little ones. And yes, it's rough. It is absolutely rough. I was working full-time as a CNA for most of nursing school, pretty much working every single weekend and one random day that rotated with my clinicals. And it was a grind. It was absolutely a grind. Everybody suffered. And so graduated 10/27. NCLEX is next. All right, James. Hell yeah. Awesome, awesome. So we're going to be doing 60 NCLEX questions here. Everybody who stayed to the very end of the live last night kind of gave some feedback. And so they wanted to do a lot of med-surg and like leadership, delegation, those like kind of fundamental topics. So we'll jump into that in just a second, but I'll use the first 2 minutes here just to say a real quick happy Thanksgiving. I just want to start by just saying I'm genuinely grateful that you're here tonight. You could literally be doing anything else. Maybe you have a plate of leftovers in front of you. I'm full, but you're choosing to show up for yourselves and for your families and for your future career. And that matters. Okay? I want you to know that matters. Nursing school is tough. A lot of you are already feeling the signs of burnout, mental fog, feeling guilty when you take a break, wondering how you're supposed to remember everything they throw at you. That's normal, okay? You're not failing. That is just nursing school. All right? So, but something that will carry you through this whole journey from nursing school to the bedside is gratitude. And I sincerely mean that, like real gratitude. Gratitude for the skills that you're learning, the responsibility that you're stepping into, and the fact that most people will never be able to do what you do. All right? These things that you're training to do, to assess, to intervene, to actually change the outcomes for sick people. All right, leading with gratitude every single day will keep your mindset healthy and positive and will separate you from that paycheck nurse who, you know exactly who I'm talking about, who comes in with a bad attitude, who is short with patients, who has complaints from other patients and staff. Okay, we've all worked with that person. So gratitude keeps you centered. All right, it keeps you compassionate and makes you the nurse that patients and your coworkers actually are relieved to see walk in the morning. All right, so thank you for being here. Thank you for investing in yourselves. And that being said, let's get into tonight's questions. All right. Here we go. All right, so Surg and leadership delegation type stuff. Again, these first few should be pretty normal difficulty. All right. All right, here we go. Let's jump into it, guys. All right, so COPD, yes, the correct answer here is going to be C, right? Because that new confusion in COPD does often suggest CO2 retention, okay? You must assess those respirations and mental status before adjusting oxygen or calling anyone. Thank you guys for the follows and for sharing the lives. Much appreciated. All right, here we go. On to 2. All right, post-operative. All right, happy Thanksgiving to all of you. All right, we're seeing some B's, A's, C's. Yep. All right, guys, good job. So here the answer is, in fact, going to be A. So because that dark red drainage in those first few post-operative hours is actually expected. Okay, that is a normal finding. You measure it, monitor the trend. Okay. B is wrong because this does not require waking up the surgeon unless urine output becomes bright red or rapidly increases. Okay. All right, thank you guys for reposting the live. Appreciate it. All right, and question 3. Client with heart failure becomes short of breath while lying flat. What is the priority action? Short of breath and lying flat. Yeah, of course, guys. Yep, the answer here is going to be C. All right, because positioning immediately improves ventilation and reduces preload. Okay, it's the fastest intervention for dyspnea. All right, we don't need to spend a whole lot of time on the rationale. There will be questions where I'm sure we will spend a little bit of time on the rationale, but not these. Thank you, guys. Beautiful. You are Jasmine for the follows. Again, guys, we're going to be doing this, let's say Thursday through Saturday. Okay, and then from there, I will be doing a regular cadence of Sunday, Tuesday, and Thursdays at 9:30 p.m. Eastern Standard. Okay, and I'll be putting that information out again just to remind everybody. Okay, so basically it's every day till Sunday, and then starting Sunday, it'll be Sundays, Tuesdays, Thursdays. All right, fantastic. All right, guys, here the answer is going to be C, which most of you are getting because LPNs can give routine oral meds to stable patients. That is classic LPN work. All right, fantastic. Good job. Good job. Good job. All right. Client receiving IV Vanc develops itching and facial flushing. What should the nurse do first? Come on. Drop it in there. Yep, 100%, guys. Absolutely, we're going to stop that infusion because the presentation then suggests red man syndrome, and the first step is to stop the infusion immediately before it gets worse. Okay? Good, good, good. 6. Client with cirrhosis has ascites and increasing shortness of breath, which finding requires immediate intervention. All right. Thank you guys for the follows and sharing the live. All right, fantastic, guys. Yep, the majority of you are putting the correct answer, which is D. D is going to be the answer because that confusion suggests hepatic encephalopathy from elevated ammonia, okay, which is going to be an emergency. All right, what some other people put B, and nope, 3.4 is only mildly low. It's not the priority, okay? Remember, the normal is 3.5 to 5. All right, 7. The nurse receives a report on 4 clients. Which client should be seen first? All right, what is expected here? Which of these are expected findings and which of these is not? All right, yes, okay, good, good, good. The majority of you are saying D. That is the correct answer because that, again, you need to tag those red flag words. All right, that is the new confusion, new onset, anything. All right, they're trying to tell you that anything new has got to be an issue. All right, these are signs of hypoxia or sepsis, require immediate assessment. All right, it's not B because pain is important, but not more urgent than acute mental status changes. All right, good job. 8. Client with DKA is receiving IV insulin. Which lab value requires immediate intervention? Select all that apply, okay? And if you're new here, I always tell you guys to treat each option as its own true-false question, okay? We're talking about DKA and IV insulin. Which options here, go line by line, is A true or false? Is B true or false? Okay, and select your answers that way. All right, almost 250 of you in here on Thanksgiving. Jesus, you must really hate your family. No, I'm kidding. Avoiding those political conversations. I get it. I get it. All right, so here, answer is going to be A and D. Okay, so A is correct because the potassium of 2.9 is obviously dangerously low, can cause arrhythmias, and especially when that insulin is going to drive that potassium down further. Okay, and D because the low bicarb indicates persistent metabolic acidosis. Okay, that needs immediate correction. It's not C because mild hyponatremia is common in DKA. All right, that is an expected finding. It's not B because a glucose of 220 is also expected as DKA improves. Usually the sugar is much higher than 220. It's usually in the 3s, 4s, or 5s. So a glucose of 220 while that patient is basically their sugar's coming down, 220 is going to be, generally within an expected range. All right, and it's not E. E's wrong because that elevated potassium is typical if early in DKA. All right, and will fall without treatment. Okay, it's not the priority compared to A and D. Okay, so. Boom, boom, boom. Question 9. All right. Okay, I'm seeing A's, C's, and D's. Majority here appear. Lana says, no idea, maybe A or C. Pick one, go with it, nail it, and move the hell on. That's the N part of the action strategy that I have a couple videos on. You can see me doing the girl hit the wham video. It's like, it's so dumb and cringe, but I think it drills the point home. Check it out. Here, the answer is going to be C. All right, position the patient on the left side with the head down. All right, so this positioning traps a suspected air embolus in the right atrium and prevents it from entering pulmonary circulation. Right, okay? So it's not A because oxygen's helpful, but not the immediate first action. B is wrong because you intervene before escalating, right? And D is wrong because blood glucose is irrelevant in this situation. Okay? 10. Holy moly, 330 of you hate your in-laws on Thanksgiving. It's okay. I'm here. I'll be your family. We've got 330 people worth of family right here. All right? Awesome. I am thankful for each and every one of you. Thankful for you guys showing up for yourselves and studying for this test. All right. I love these. What task can the UAP do? All right. In other words, a CNA, somebody who doesn't have a license. All right. We are going to be doing A, B, and E. Okay. So looks like the majority of you had A, B, and E with a couple variants. So it's not C because reinforcing teaching is going to be for the LPN or RN. Okay. And it's not D because first ambulation requires an RN for safety and assessment. Okay. So A, B, and E. A, B, and E. 11. And for that last one, why B? Because finger stick glucose checks are routine UAP tasks. Okay? UAPs can check blood sugars. As far as the NCLEX goes, UAPs can, obviously scopes vary location, but UAPs can check a BGL. All right. What is the priority? Administer the missed dose. Prepare for intubation. All right. You guys are kind of all over the place here. What is the nurse's priority? Answer here is going to be B. Okay. So the reason it's B is because this presentation suggests a myasthenic crisis. Okay, that can rapidly progress to a respiratory failure. So airway management is the first priority. Okay. So A is wrong because given the medication now will not reverse the acute respiratory compromise quickly enough. All right. Yep. Yeah. So actually, yeah. So they see it. Yep. So if you think of the one thing that one of these answers, if you had to do one of these answers and ghost the patient and never come back, what's the one thing that would actually help them? So here, the answer is going to be B. Okay, it's not C because just rest is not it's just not the move when your diaphragm is clocking out, okay? And it's not D because although infection can trigger a crisis, the airway takes priority over that detective work, okay? All right, Keisha, sorry, you took the wrong NCLEX. Yeah, no, these first 10 questions are meant to be a bit easier. So I'm glad that you think that they're easy because these are more or less the warm-up questions. All right, 12. Here we go. A client with acute pancreatitis develops serum calcium levels 6.7, and reports tingling around the mouth. What should the nurse do first? No, this is not UWorld. These questions only exist here. These questions are unique to me. All right. Good job, guys. Yep. Question here is answer here is going to be A, right? Because the calcium of 6.7 is critically low. All right. The normal is 8.5 to 10.5. And so this increases the risk of seizures. Okay. So safety comes before all interventions. What else were people saying? It's not C, because you do not need to spend time confirming physical signs when you already have a critically low lab plus the symptoms. Bro, Ryan, there was no E. There was no E. And B is wrong because IV calcium will be given, but you need to stabilize and protect first. Okay? You need to stabilize and protect. Okay. 13. Thank you guys for sharing the live. Absolutely amazing. Thank you guys. I am grateful for you guys sharing the live and following. If you haven't already, we'll be doing a lot of these. Yeah, I mean, I failed the NCLEX the first time too, but it's because I didn't have a good enough plan. 13, yep, answer here is going to be A. All right, because a map of less than 65 and a lactate of greater than 4, despite fluids, indicates septic shock, okay? And you need vasopressors immediately, okay? Don't worry, it's not a sign. Get out of your own head, all right? It's not a sign that you're gonna fail the first time, all right? You're here, you're studying, you're putting yourself and your education first here. So yeah, it is hard. If it were easy, everyone would pass the first time. Okay, it's meant to be hard. Just think safety. So if you're moving too fast, you can also, you can take screenshots. I do post this recording on the whole video on the YT, okay, that separate app under Nurse Jimmy Official. Okay, I got two additional ones uploaded today, so they're there. Okay. All right, 14, answer is in fact B, right? Because that first tube feeding through a new peg must be done by an RN due to the risk of dislodgement or aspiration. Good job, I think all of you got that. 15. Client with PE is receiving IV heparin. The latest APTT is 128 seconds. What should the nurse do? What should the nurse do here with an APTT of 128 seconds? Okay, are we guessing? We're just like, man, do we know what a normal APTT is? Yep. So most of you are saying C, which is the correct answer, right? Because that APTT of 128 is critically high. The normal value is 30 to 40 seconds. All right, the therapeutic range is 60 to 80. Okay, so the infusion must be stopped. The provider must be notified. All right, I think the majority of you got that one. 16. And for those of you joining, we are doing 60 of these. So we're moving through. We are just trying to stay on time-wise, 60 questions, 60 minutes. So I'm going to be moving through these a little bit faster. You can always watch this back on that other app. Okay? Or if you have a notebook in front of you, you can kind of jot down like, hey, the question number, take a screenshot, the question number, and then what I said was generally the rationale. Whatever you want to do. I don't know what you guys are doing. I'm just talking to a screen. So weird. All right, so here, answer is going to be B, right? Because sodium of 118 with headache indicates possible cerebral edema. So you need that hypertonic saline. That's the immediate intervention because a normal sodium is 135 to 145. All right, good job. Good job. 17, here we go. Thanks for sharing the live, guys. If you haven't already, you can if you feel so inclined, you can also share the live, get more people in here. You can also follow, get tons of content. All right. Yep. While you guys are doing so, yeah, my plan, I do custom NCLEX study plans. You can find those via the link in my bio, and they are totally based on you, your resources, your subscriptions that you already have access to. They are for new test takers and repeat test takers. And if you're a repeat, it's based on your CPR. So I will figure in your CPR and shore up those weaknesses to make you stronger and more confident for your next attempt. Okay, so all that's available in the link in my bio. And yes, here the answer is going to be A. All right, so A is the answer because Cushing's triad indicates increased ICP, right? Excuse me. And elevating the head of the bed reduces pressure immediately. So what are those symptoms of Cushing's triad? Widened pulse pressures, bradycardia, all right, and irregular respirations. Widened pulse pressures, bradycardia, irregular respirations. 18. Here we go. There we go. Steelers. Here we go. Anybody watch some football today? Anybody's team play? I'm a Steelers fan. I've got the Ravens and Bengals on in the background. The Cowboys. That's all right. Again, I'm a Steelers fan, so I don't really dislike many NFC teams. I hate the Ravens, though. Sorry if you're a Ravens fan. All right, so 18 here is, in fact, B. Bravo, right? Because the new confusion, that's one of those red flag words, in a client on steroids indicates possible steroid psychosis or infection and must be assessed immediately. Okay, yeah. New onset, post-op day 1, new confusion, restlessness, blah, 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 blah. Okay, anything that you identify in an answer that is not expected or chronic is probably the answer, okay? Probably the answer. 29. All right. We're a couple questions behind schedule. Thank you, Steph and Leslie, for the follows. Emily for the follow. I'm full AF. Yeah, girl. Persian Honey. I know you've been in here every single live, so still made it. Happy Thanksgiving. Hell yeah. All right. Okay, so 19 is which client is appropriate for the LPN? It's going to be C, right? So you see LPN, you think stable patients, okay? So yeah, we don't need to spend too much time on that. But yeah, a stable patient. What's A mean on this patient? All right, A, because airway injury is an RN only assessment, all right? Because that's what that burn patient with nasal hairs, that's going to be in airways. That's not going to be anything for an LPN. If you see LPN in the question and you see an answer that says something about a stable patient, last question, why not A? Which client requires priority assessment? The one with ulcerative colitis. Now, I mean, because the frequent bloody stools are common with ulcerative colitis and it's not the highest priority. It's common. That's a common symptom of UC. Okay. 20. Here we go. Client with total parental nutrition suddenly develops shortness of breath and chest pain. The nurse notes that the TPN bag has run dry. What should the nurse do first? All right. Thank you, guys. Thank you, Ashley, for sharing the live. All right. Oh yeah, what are you guys drinking on tonight? Post Thanksgiving. Anything good? Future RN, you got wine, you got water. What you got there? I got a little scotch here. A little scotch. All right. Jennifer's just got water. You got clinicals tomorrow. That sucks. All right. So here, answer is going to be C. Oh, so they got a White Claw. Haley's got vodka. Jeez. All right. Excellent. All right. We're in a good mood then. All of us are A-okay. Answer here is going to be C, guys. All right. Because a dry TPN line increases the risk of an air embolism. So clamping the catheter and positioning the client on their left side traps that air. Okay? Correct answer here is C. Okay? All right. 21. 400 people in here on Thanksgiving, guys. What are you doing? That's all right. You guys are putting your education first here. Hell yeah. All right. If you're new, thank you guys for sharing the lives that you're doing. Thank you guys for the follows as well. We are, hey, that's right. Dedication, baby. This is what it's all about. It is grind time. We are grinding for that license, and you will get there. Chasing that RN behind my name. Yep. And we've got some, I love to see that we have current nurses in here. Yeah. So we've now reached a different level of question. Okay. These questions are a bit harder if you haven't already noticed. All right. So 21. Answer here is going to be B. Okay. Because an ARDS with refractory hypoxemia, okay, proning improves ventilation. It improves that ventilation perfusion, matching and oxygenation, and is a key escalation jet. Proning is turning your patient literally on their stomach, okay, while on a ventilator, okay? That's what proning a patient is. Typically, you only see this in the ICU, okay? All right, I'm telling you, questions are hard. Can you answer? All right, I don't have a lot of time to go into in-depth explanations here, guys. So, but yeah, the answer was B on that last one. So if you got B, great. 22. A client with decompensated heart failure is receiving continuous IV infusion of nitroprusside. Okay, we've got new confusion, and the client's blood pressure is now 80/50. What should the nurse do first? Yeah, if you guys were confused with proning, look it up, okay? Just jot it down on a piece of notepaper beside you and look it up. It's actually really interesting stuff, okay? All right. Proning was really popular. There's a lot of articles about it during COVID, when COVID was really bad and there was a lot of people on ventilators. A lot of ICU nurses were talking about that. All right, 22. Correct answer is B. B, right, because the nitroprusside, I can't say that freaking word right now. I've never given it in my life. Can cause profound hypotension and toxicity. Okay, so that BP of 80/50 with confusion indicates that there is some cerebral perfusion. And so the first step is to stop the drug. Okay, stop it. 23. If you guys are just joining, we're going to 60. All right. 60 NCLEX questions with a primary focus today on med-surg and leadership and delegation. All right. That is the primary focus today. Thank you guys for the follows. You guys are freaking incredible. I'm here for you guys. Here for you guys. All right. 23 is going to be C. All right, so if you got C, good job, right? Okay, so here, C is correct because elevated ammonia can precipitate that hepatic encephalopathy. We had that in a question earlier tonight. So that leads to the decreased LOC, risk for aspiration, coma, airway compromise, all that stuff. So, what's a normal ammonia? It's 15 to 45, okay? 15 to 45 micrograms per deciliter. Boom. All right, normal INR is 0.8 to 1.1. All right, anybody want to drop the normal platelets in here? All right, and normal hemoglobin's 12 to 16. Awesome. Love that these lives are giving you confidence. Yep, Persian honey. Yeah, well, it's going to be 150 to 400. According to what resource you look at, but NCLEX is going to want 150 to 400. All right, 24. Here we go. Good job, guys. Yeah, you guys know your platelet levels. Hell yeah. 24, charge nurse, signing clients. Which client's most appropriate for the LPN? Let me guess. It might be the answer that has the word stable in it. Okay? Yeah, Narna knows. Narna knows. Okay? All about stability. Maybe the stable one. You're absolutely fucking correct, guys. All right, do we need to discuss this? All the others are wrong because they're not stable enough, except for the one that says that they're stable. All right. Here we go, 25. All right, post-operative client with a history of obstructive sleep apnea is receiving IV opioids for pain, and the nurse finds the client difficult to arouse. Respiration rate of 8 with shallow respirations. What's the priority action? What's the priority action? In other words, if you could only do one thing and then leave the room and never come back, which thing is going to help the patient the most? Okay. Wait, hold on. What was that? Nico just said, I was here Wednesday night and passed my comprehensive predictor the day after. Well, obviously, I'm going to take credit for that, Nico. No, I'm not. You did the work. You passed the test. Drop a dub in the chat for Nico, guys. Good job, Nico. Oh, yeah. All right. So, you have a med-surg test, GI on Wednesday. Here we go. All right. So 25 here is going to be B, right? Because that respiratory rate of 8 with shallow breaths indicates that opioid induced respiratory depression. So you need to give that Narcan immediately. All right. Oh, and Mika passed her I'm assuming Mika is female. Your comprehensive exam on Wednesday. Hell yeah, guys. No, it's not. No matter what your age is, you should pursue what you're passionate about. All right. Jesus. Sorry, don't do that one, guys. What number were we on? That's 36. I think we were on like 26. Were we on 26? Chill, guys. Chill, guys. I know it was too big. All right. 390 of you in here. Yes, the questions are getting harder. The first 10 to 15, 20 were kind of layups, in my opinion. But 20 to 60, these are more in line with what you're going to see on the NCLEX, okay? The NCLEX is not going to be just like basic recall questions. 26, answer here is in fact B, okay? So yeah. So aggressive IV fluids in that advanced chronic kidney disease with port clearance can cause fluid overload and pulmonary edema. All right. So let's keep it going. Oh my gosh, what? Ugh. Sorry. I don't know why this keeps resetting. Mika, I'm sorry. I'm sorry. 27, which... Okay. Sorry, don't worry about my forehead in here. I'm just seeing what... Okay, here we go. All right, 27 here, guys, is A, right? Okay, so A is correct because a client who just returned from surgery requires an RN assessment and RN obtained initial vital signs to detect any early complications. Okay, you do not delegate the first set. Okay, it's not D because UAPs can obtain orthostatic BPs, but the RN has to interpret the results. Okay, 28. All right, we are a few minutes behind schedule, so trying to get through these a little bit. I'm sorry, Persian honey. I'm sorry, we're a little behind schedule. We're trying to do a question every 45 seconds or so here. All right, the majority of you are saying D. Okay, nope. The answer here is going to be B, guys, and I'll tell you why. So it's not D because stopping norepi abruptly can tank BP and worsen shock. Okay, so it's not D. The answer is B because you must first assess blood pressure and map, ideally greater than 65, to determine if the perfusion is going to be adequate and if vasopressor titration or fluids are needed. Okay? All right, Kendra, thank you. Map, mean arterial pressure. Okay? You want it to be greater than 65. All right, and it's not C because a fluid bolus decisions are based on hemodynamics, okay? Not vibes. 29. All right. What's the priority change in therapy? If you guys feel confident about any of the questions your peers are asking in the chat, feel free to answer them because I'm sorry, I don't have capacity to answer all the questions. All right, so 29 here is going to be B. All right, so B is correct because once the glucose approaches 200, dextrose is added so the insulin can continue to correct the acidosis without causing hypoglycemia. All right. So it's not A because you cannot continue normal saline and insulin without dextrose, okay, at this glucose level. It's not C because switching to sub-Q insulin too early can cause rebound ketosis. And then it's not D because increasing insulin without dextrose risks dropping the glucose too low and worsening hypokalemia. All right. I know that's a lot. That's DKA. That is the whole shebang. When you're doing clinicals, if you're still doing clinicals, your hospital probably has a DKA protocol or flow sheet. You should get your hands on a copy of that. All right, 30. Yep, you guys are all over this one. Answer is D. Because assessing pain is an RN responsibility. The UAP can ask the client if they're in pain, but cannot formally assess or document pain levels. 31. All right, Taj, thanks for sharing the live. All right, and I also obviously appreciate all of you who are liking the live. That helps boost the live up in the rankings, and I appreciate you guys following who haven't already. Much appreciated. We'll be doing this literally every single night through Sunday, and then from there it's going to be Sunday, Tuesdays, Thursdays at 9:30. Okay, Sundays, Tuesdays, and Thursdays at 9:30. We're going to be doing these All right, Can't Stop, Won't Stop, Hannah, Yoha, Pensky, Gabby, Ava, the Jonas. Oh my gosh, all these follows. Thank you guys so much. Miss Munya, thank you for the follow. All right. 31 is going to be A, right? You guys are killing this question. So it's correct because hypotension, tachycardia, and a low H&H indicating significant blood loss. Okay, so restoring that volume and the oxygen carrying capacity is the priority here. Okay. All right, fantastic. Good luck, guys. Hashtag Team Pharmacist. Oh, Dalron, are you a pharmacist? If you are, hell yeah, man. Welcome to the chat. All right, thank you guys for the follows. You guys are awesome. All right, 32. Here we go. Over halfway, guys. Over halfway. What is the nurse's priority action? Mindy and Shelly, thanks for the follows, guys. Oh, Yolanda, thanks for sharing the live. All right, bunch of A's, bunch of C's. So far, it seems like the answer to 31 was A. Start a pack of red blood cells. All right, so 32 here is going to be also A. All right, so A is the answer because the presentation is an adrenal crisis. All right, and that IV hydrocortisone is life-saving and must be given immediately. Okay? Nope, it's not D because dietary potassium changes are not useful in this acute crisis. Okay? I think I only really saw like A's, D's. And it's not B because dextrose helps but does not address the underlying cortisol deficit. Okay? 33. Nurse is assigning clients on the step-down unit. Which client is best assigned to a float RN and from the surgical unit with no recent cardiac experience? Okay? In other words, you're going to want to give them the most stable patient. Which patient here is the most stable patient? Would it be the one that has been stable in the answer? Probably, right? Yeah, the answer is C, guys. Fantastic, good job. All right, because they're stable. Predictable post-op client, right? Closely matches the float nurse's usual skill set. Great, 34. Post-op after 24 hours is stable. They are stable, period. Clock it. 3 Galen kids' moms. Clock it. Y'all are dumb. Y'all, don't make fun of me. Don't make fun of me. I can use my Gen C slang. Hey, Nikki, if you weren't in here, were you in here yesterday when we were talking about placenta previa? All right. Because in placenta previa, we were talking about not getting in it, okay? You don't want to get in it in placenta previa because you might cause a hemorrhage, okay? So no exams, no digital exams, no looking at anything. Don't get in it. But placenta previa. 34, answer here is going to be A. All right, because that potassium is 6.8 with EKG changes is a life-threatening emergency. So you need that IV insulin with dextrose rapidly, so that rapidly shifts the potassium into the cells. Okay, I think pretty much all of you got that. Good job, 35. Yep, or the floodgates will open. It will be a bad day. I'm glad you guys are having fun. Somebody said, oh, these questions are so much fun. Well, I'm trying. We're trying to have fun. It's all up to you guys. I'm literally just here in my house talking to a screen. So I'm trying to bring some energy, trying to manifest that. So correct answer here, yes, is C. Good job, guys, because that suspected diversion must be reported through the chain of command according to policy to protect the patients and the staff. Okay, let's go. 36. Thank you guys for answering some of the other students' questions. You guys are awesome. You guys are awesome. I swear to God, I need some music. I don't know if I can. All right, 36. Seeing a few answers, some C, D, B. All right, answer here, guys. She's like, I need my ABG paper. I need to do my tic-tac-toe. Okay, I can't do it without my tic-tac-toe. All right, answer here is going to be B. All right, B, bravo, right? Because we're talking about respiratory acidosis with hypoxemia. So despite that high flow of oxygen suggests impending respiratory failure, okay, and may require intubation. So you kind of need to just know these levels a little bit, all right? So, yeah. All right, so 37. Yep. Oh, Kendra, respiratory thing. Hey, do you love just being called respiratory everywhere you go? Like, you're not Kendra. You're respiratory. Or I always think about that with or radiology. Hey, where's respiratory? We need radiology. Radiology, are you here? So accurate. Yep. You shouldn't even put your name on your badge. You just respiratory. Nope, never have names. I have no idea what the names of my RTs are. No idea. I just know they're respiratory. That's terrible. I'm sorry. I know you, Kendra, so thank you for showing up. UAPs are CNAs. They are unlicensed assistive personnel. Okay, those are your techs. All right, that's who we're talking about with UAPs. Become familiar with that terminology. You will see that on the NCLEX. Okay, answer here is going to be B. All right, because obtaining baseline vitals is within the UAP scope, but the RN has to interpret the results. Okay, pretty basic. 38. Boom. Oh, I was trying to put on music. I don't know if I'm going to be able to log into my Spotify from here. It's also 10:15 and people might be sleeping. All right. Alexa, play some country music.
The station, Country Heat Radio, on Amazon Music.
Alexa, turn it down to level 3. All right, 38 is going to be B. Yep, absolutely. All right, so B, because the HSS treatment begins with aggressive fluid resuscitation using that isotonic saline to correct the profound dehydration and hyperosmolality. Okay? All right, 39. Alexa, turn it down. Mm-hmm. 39, here we go. Nurse manager notices an increase in medication errors on night shift. What is the best initial action to address this quality issue? All right. Yep. Good job, guys. You guys are nailing this one. It's C. right? Because the root cause analysis will identifies the system and process factors contributing to the errors. Okay. Good job. 40. Who's tired? Who's tired? I know none of you are tired. Night shift. Oh, yeah, night shift's tired. Night shift's definitely tired. All right. Yeah, good job, guys. Majority of you are saying A, and that is the correct answer, right? Because the meningococcal meningitis is highly contagious. Drop of precautions must be initiated, okay? But not B, because antibiotics are critical but come after appropriate isolations in place, okay? All right, Adira and Cruz, thank you so much for the follows, guys. If you guys haven't already followed, I genuinely appreciate it. Definitely helps me grow this channel and reach a larger audience. So thank you guys for those follows. Okay, here we go. 41. 41 GP, thanks for the follow. You are welcome for this knowledge. Nana, that's what I actually call my Nana. My Nana's dead, but that's what I would have called her when she was alive. Oh my god. Question 40 was A. Put them on droplet precautions. All right, 41 here. Majority of you are saying A, which is the correct answer because the potassium of 2.8 is an immediate arrhythmia risk, right? We talk about this every night. If you see that low or high potassium, it is often the answer, okay? To correct that, because life-threatening arrhythmias is something that needs addressed quickly. 42. Maria, thanks for the follow. All right. Love that you guys are all here on Thanksgiving. Fantastic. Hopefully you guys all had a good dinner and got to hang out with some family. And if you didn't, well, you got 250 family members right here. All right. Just bullshitting here, answering some questions. Hanging out. In between answering this question and the next, go ahead and drop where you're from. I always like to see where people are sitting at, where they're from here. See how far we're reaching. All right, 42 is going to be D. And so D is going to be correct because the initial teaching for a new diagnosis is that RN responsibility. And we're touching every state in the U.S. here. Haiti, all right, awesome. Boston, fuck Boston. I'm just kidding. You're good. I'm also a Yankees fan, so it's cool. We're cool. Somalia, okay, Africa, I see you. San Diego, Minnesota, Ottawa, Canada. Saw a few Canadians, and you guys were literally Nigeria. I actually have a pretty strong presence in Nigeria. According to my TikTok analytics, it's like the next country down after the United States. So I don't know, Nurse Jimmy's going wild in Nigeria, which is kind of hilarious and crazy. All right. Is the answer D? Yes, the answer is D. If you're just jumping in. Ethiopia. Hell yeah. Oh, I love me some Ethiopian food. Love Ethiopian food with the injera and all the and you use it to dip it into the collards and all the lentils and so good. Anyway, little tangent. Here we go, guys. 43. And yes, the answer was D. If you guys haven't tried Ethiopian food, just if you have, a restaurant somewhat local to you, I highly encourage going outside your comfort zone and trying some Ethiopian food. It is so fucking good. This is a little bit of both RN and PN, okay? Originally from Sudanese fan. So also, fun fact, I'm vegan. So yeah, I love ethnic food in general because it's a little more less meaty. There's a lot of vegan. They're pretty vegan friendly. So yeah. Here we go. 43 is going to be B, right? Because NG tube insertion is right here. So NG tube insertion in a suspected esophageal varices can worsen bleeding and is generally avoided unless specifically ordered after an endoscopic evaluation. Okay? So good job, guys. You got 43 there. 44. All right, we need to press the gas through some of these. All right, 44. Here we go. Which one should be assessed first? So which one is the sickest? All right, you guys are getting this one right. B, sudden. That's that tag those keywords. Sudden shortness of breath. Okay. 100%. 45. Nurse is preparing to delegate care on a busy shift. Which client is the best assignment for the LPN? Yeah, okay. Which is the best one? It's going to be the most stable one. Which one's the most stable? Yes, exactly. You're starting to see why they say look at these, and I call them red flag words: sudden, new onset, confusion, restlessness, post-op day 1. Okay? When you see these words in these answers and questions, you must pay attention to it. Yep. Why? Oh my goodness. In C, it says the word stable. Yeah, absolutely. And you'll see this. They're not trying to be super tricky here. Okay? 46. So yeah, the answer is C. That's stable with predictable care. It matches that LPN scope. All right, 46. Here we go. Okay. Seeing a bunch of A's so far. Okay, good job, guys. Right, because a trough of 28 is super therapeutic. Okay, it's too high. It increases the risk of nephrotoxicity and ototoxicity. Okay, so that dose should be held and the provider should be notified. Okay, 47. Okay, lots of A's. Fantastic, guys. Good job. Yeah, because that C. diff is going to require contact precautions and hand washing with soap and water. Okay, alcohol, hand sanitizer does not kill the spores. 48. All right. Yep, you guys are nailing this one. Majority of you are saying D, which is the correct answer. Good job, right? Because thrombocytopenia, okay, because again, normal platelets, you guys all said it earlier, is 150 to 400. 150 to 400,000. Okay, so in severe sepsis, can indicate DIC due to widespread consumption of those clotting factors and platelets. Okay, All right. Yeah. DIC is disseminated intravascular coagulation. Okay, it's life-threatening. Disseminated intravascular coagulation. Okay, 49. Alexa, turn it down. Mm-hmm. 49. All right, what do we got, guys? Drop your answers in the chat. All right. Okay. D's and A's. D's and A's. All right. So here, which one must the nurse see first? So, okay. So the answer here is going to be D. All right. Because I'll tell you why. Because that perioral and fingertip tingling post thyroidectomy suggests hypocalcemia from a possible parathyroid injury, okay? And it can progress to a laryngospasm. So that normal calcium is 8.5 to 10.5. So we have an possible airway issue, okay? So you guys are also saying A. So a respiration rate of 10, and it says easily arousable is kind of concerning, but less emergent than an airway risk from hypocalcemia. Okay. Good job, guys. Good job. You guys are killing it. You guys are doing really, really good. You should be really confident in how you're doing. All right. 50. Nurses planning assignments. Which client is best for the UAP? Yep. 100%. Well, it also says, right? I mean, and you're not, this UAP is not getting an assignment, okay? Yeah, this is easy. This does not fit the rest. Yep. So bed baths, definitely going to be appropriate for a UAP, for a tech. 51. Here we go. Client admitted with severe thrombocytopenia and active epistaxis. Which order should the nurse implement first? All right. Awesome. Thank you for sharing the live. Appreciate that. And thank you guys for the follows. We're going to be doing all these every single night this week through Sunday. And then from Sunday on, it's going to be Sundays, Tuesdays, Thursdays at 9:30 Eastern Standard. All right. 51 is going to be A. All right. Because immediate direct pressure and positioning is going to help control that active bleeding right now. All right. So those normal plate levels, again, 150 to 400,000. All right. They are at a very terrible bleeding risk. So we need to apply pressure to the nose and get them upright, period. All right. Some of you put B. Yeah. Okay. Transfusion is appropriate, but it's going to take time to prepare. You need to stop the current bleed. Okay. 52. JG, thank you for the follow. Greatly appreciate it. Guys, if you haven't also followed, be tremendously helpful to me just to grow this audience and reach more people like you. Get more people in here. So that follow button's on up here at the top if you haven't already. Thank you so much. All right. Yep, 52. Most of you are putting B, which is the correct answer. Okay, so here B is going to be correct because the presentation suggests severe alcohol withdrawal or impending delirium tremens. So those benzos are the priority to prevent seizures and further autonomic instability. All right, what else were people putting? It's not A because reorientation alone is not going to stop withdrawal. It's not C because environmental modifications are supportive, but not the first line. Not D because snacks aren't going to cure DTs. All right. Although some people might think snacks cure, patients sometimes think snacks cure DTs. Or they're like, "Meow, I'm hungry. I want a turkey sandwich and some graham crackers." Oh, we're going to measure neuro. We get them often. Yeah, absolutely. You see this withdrawal patients all the time. 53. Which activity is most appropriate to delegate to the experienced UAP? Don't be flabbergasted by the experienced UAP. Okay, you know their scope. All right. Treat each one as its own true-false question. All right, so the answer here is going to be A, C, D, and E. Okay? It's not B because the initial teaching on a device use is going to be the RN responsibility. Okay? Looks like the majority of you got A, D, and E, A, C, and D. All right, so UAPs can perform bladder scans once trained, and C, repositioning is appropriate if spinal percussions are taught and maintained, and D is okay. UAPs can measure and document INOs, and E, transporting a stable client is a standard task. Okay, 54. Yep, you know how to turn. All right. Mm-hmm. Good. Yep, guys, majority of you are putting B, and you're gonna say, start putting them UAPs to work. Hell yeah, make them earn that money. I was a UAP as well, and definitely get worked. Answer here is going to be B. Okay, because that uncontrolled hypertension accelerates kidney damage, right? And increases the risk of stroke, cardiovascular events. And so, yeah, controlling that BP is going to be the most immediate modifiable risk. Yeah, earn that $17 an hour. Did you know? I live in the Southeast in North Carolina. Did you know that Starbucks baristas down here make $23 an hour? I'm like a regular and friends with the store manager, and she was like, "Yeah, we pay like $23 an hour plus like career benefits." I'm like, "What the fuck have I been doing? I should have been working at Starbucks while I was going to nursing school." Shit. All right. Yeah, it's surprisingly good. All right, so we just did 54, so 55. 5 more, guys, 5 more. There we go. Thanks for staying with me. Dun-dun-dun-dun. Client is increasingly confused and restless. All right, yep. Answer is going to be A because with that hypernatremia, with those neurological symptoms, that's going to require prompt correction with free water, okay, under that provider guidance. Okay, good job. 56. Not sure. I'll try to go back to 54 after we're done here. Sorry if I skipped one. All right. Which client must be assigned to the RN? Okay, yep, answer's going to be B. Yep. Nope, I didn't have any mental health questions because we weren't doing mental health. We were doing med surge and leadership and delegation today. All right, so the correct answer here is going to be B, right? Because a new diagnosis plus discharge teaching requires RN assessment and education. Oh, did I see somebody say they passed? Awesome. Sugar and Spice Cosmetic, you passed your boards Monday. Fantastic. Congrats. I did mental health yesterday on the live, literally yesterday. We did maternity and mental health. So I'll have that live recording posted on the YT under Nurse Jimmy Official probably tomorrow. Okay? We're not going to, so be every night this week through Sunday, and then starting Sunday, it will be Sundays, Tuesdays, and Thursdays at 9:30 Eastern. All right, bye Gypsy, thanks for following, appreciate that. All right, so 57, here we go guys, 57. Client with suspected PE. How many says we need more maternity and delegation? You guys are always so scared of maternity. And if you guys want some more maternity cheat sheets, okay, go to the link in my bio. There is a free NCLEX vault that is just cheat sheets. There's a whole maternity thing there. All right, it's just one of the many subjects that's listed there. It has a mini test after each section. Go check that out. It's in the link in my bio. All right, 57 is B. Okay, so because that low PaCO2 and high pH indicates respiratory alkalosis, okay, from hyperventilation. So while the PA2 of 60 shows hypoxia, these are classic for early PE. Okay. All right. Gunner, thanks for following. Carousel, thanks for following. We're almost getting to the end, guys. So if you haven't already, tap that follow button. Go ahead and do that now. I really appreciate it. We're going to be constantly doing these, and I'm going to be putting it up in my story, and I'll make a video usually prior to, just to keep everybody in the loop on when I'm going live. So definitely doing at least 3 of these a week. We'll be doing these every night this week through Sunday at 9:30. All right. Yep. Good job, guys. Answer here is B, right? Because the nurse must first ensure the client's safety in the moment, right? Then provide immediate just-in-time teaching to correct the unsafe practice. Okay. Good. All right. 59. All right. And if you guys are looking for a little extra structure in your studying, I do offer NCLEX, custom NCLEX study plans. They are $25, but that just is based on the amount of time it takes me to do them. And I can usually turn them around in 24 to 48 hours, but they follow your resources, your weaknesses. Okay, so all that's available in the link in my bio. All right, 59. The answer is going to be A, B, D, and E. Okay, looks like a lot of you got A, B, and E, but not D. So here, guys, so right, A, because yeah, you're going to clamp the line, prevents further air from entering. B, because that left side plus Trendelenburg helps trap that air in the right atrium. D, because oxygen supports tissue perfusion and can help reduce the size of the air bubble. All right, and then E, because a suspected air embolism is an emergency requiring rapid provider or team response. Okay, not C, because hanging more TPN is basically the exact opposite of what you want when you suspect an air embolus. Okay, so not E. I'm sorry, not not E, not C. So, excuse me. E is correct. C is the one that you don't want to do. You don't want to start another bag of TPN immediately. Not C. Correct. Not C. All right. And 60. All right, guys. Here we go. Thank you guys for chatting it out with each other and answering each other's questions. I did PEDS 2 days ago. Did I do PEDS 2 days ago? Yeah, I think I did. Maybe it wasn't specifically PEDS. I did OB yesterday. I did OB and mental health yesterday. I feel like I did a lot of PEDS 2 days ago, but we can work in more. We can work in more for you coming up. All right, if you guys stick around after this question, we can kind of talk real quickly about what you want to see in the future here in the next couple of days. Okay, and yes, good job, guys. The majority of you are saying A, C, and E, and that is correct. A, C, and E are the correct answers. So it's not B because it minimizes the client's feelings. All right, even if it sounds reassuring, and D is wrong because it's dismissive and puts pressure on the client instead of supporting them. Okay, so bada bing, bada boom. So that's kind of where we're at, and yeah. So yep, my live is recorded, and I'll post it over on YT. I know my face. Look at this thing, guys. How you doing? Right? So, Alexa, stop. All right. So, what would you guys like to see more in the future? You thought it was just a box, like was it like that Marshmallow, the Marshmallow singer? Just like, where's the marshmallow? I said. Yeah, absolutely. You're so welcome for. So some cardiac. You guys were saying PEDS. Okay, yeah, we can work some of that stuff in. Some more next gen questions, prioritization. I'm gonna watch this back, so just drop in what you want to see, and I'll kind of look at what is getting the most traction here. All right, so while you guys put that in, again, if you guys are looking for a little more structure in studying, the NCLEX study plans are based on your life. You're very, very busy people, obviously, and you have access to a lot of resources and information, but sometimes the issue is you have too much access, and you don't really know what to start or what to study or how to shore up weaknesses. So that's where the custom NCLEX study plan comes into play, which is accessed via the link in my bio. And it takes all of that into consideration. And if you're a repeat test taker, I take your CPR and work that into the study plan to make sure that those weak areas on your CPR are getting addressed and helping you come back at this next attempt stronger and more confident. Okay, so check it out. It's $25 just because that's what I felt my time was worth to do them. And I'll get it back to you within a day, no more than 2 days. Okay, so check that out. And then also there is the NCLEX Vault, which is free. Just ask for your email address, and that's just a compilation of cheat sheets on every single NCLEX subject. And then there's a mini test after each specific section. Okay, so there's a lot of information there. There's a strategy guide. Do you ever go over bow tie questions, case studies? Yeah, I can work some of that stuff in there. I'm gonna try to figure that out. Scenario questions. Okay. Yeah. Also, on my profile page, I have a whole, after this, go look at my profile. I have a whole NCLEX playlist that it's about 30, I think 32 or 33 parts. And I've had people message me. It was like, oh my gosh, I just found you 2 days before my NCLEX and I binged all your videos and I saw a lot of questions that were in your videos. So we don't just do this. So I have a whole 30 plus part series on the NCLEX and breaks down each subject, different strategies. So after you leave here, just go to the page, watch as many as you want. But yeah, if your test is coming up, they're definitely bingeable. Okay. Take a break from Stranger Things, pop on a little Nurse Jimmy. Okay. And yes, Omar, thank you. I did see that that study plan come through. I'll be getting that over to you no later than tomorrow. Okay. As far as the question about the YouTube, that's where I post the long form. I post this whole recording over there. Okay, under Nurse Jimmy Official. Okay, so some of the lives from this week are already over there. If you wanted to check that out, and subscribe over there. So that's what we got going on. If you guys, 134 of you, are still here, if you haven't already, we're getting ready to wrap up. But go ahead and follow up there, and you will be more in the loop, be able to see when I'm going live. Usually I'll post it in my story first, and there'll be a little link to register. And then so at 9:30 when I go live, TikTok will send you a notification because you already pre-registered. So, but go ahead and follow if you haven't already. But is there anything else that you guys are looking for? Let's see. Any other questions? Do you know where you're going? Not yet. Not yet. I'm going to review the last couple minutes of this recording tomorrow and see what the majority of people were asking for, and then I'll work it in. All right. I will work it in. Fiona, you still here? Fiona's been here every single day. I know a lot of you guys see a lot of familiar handles. So awesome. Yeah, thank you guys for staying. I know Semi-Lunar, you've been here the entire time. Yeah, you guys, this is the hardest thing that you guys probably have ever done in your lives up until now. Nursing school is no joke. And as you can see, you probably did not end with the same number of people that you started with. It is incredibly difficult. And the skills that you are learning are incredibly valuable. And you should be very, very grateful for what you're actually able to do for another person, for the patients in the hospital, for the sick. And if you go into work every day with that mindset, you're just going to feel a lot more positive about your job, about what you're doing, and there's going to be more fulfillment there. And so I feel like that really will help prevent burnout. I really, truly do. Our profession is right now in a tough spot. A lot of people leaving, a lot of people burned out. You know, I do think that things are going to get better, but, you know, it starts with you, right? It starts with you. It starts with your mindset. There's a lot of things that you cannot control. You can't control how doctors act. All right, right. You can't control how patients act, but you can control how you act. You can control your mindset. And when you come into work with a positive attitude and you feel grateful for the skills that you have and your abilities, and it just exudes this positivity, and people notice it. Coworkers notice it. Your patients notice it. Okay. And that just makes the entire patient experience that much more better for them and for you, and decreases burnout. Okay, I'm sure. I feel like I'm sure of it. So don't be one of those paycheck nurses that just shows up and is disgruntled and complains and just is annoying to be around. I know a lot of them, and I just ignore the drama. So thank you guys for staying this long. I'm going to go to bed. It's 11 o'clock. I don't know, are any of you maybe going for good? Been a CNA for 15 years. My heart is as full as ever. Fantastic. I love that. That's amazing. Absolutely, Tina. No problem at all. I don't know if you guys are going Black Friday shopping, but if you are, stay safe out there. It's probably going to be nuts. I will not be out there. All right, so goodbye from the talking head. Thought it was just a box. All right, so, and if you haven't, just check out that playlist online. And again, there's a couple things in the link in my bio. That's it. All right. We'll see you tomorrow. Adios.